Allied Medical Meditec presents Vista Ventilator, an advanced, microprocessor-controlled, pneumatically driven ventilator. The Vista Ventilator is designed to provide universal ventilation for patients of all ages, from neonates to pediatrics and adults. A generous 15-inch touchscreen display revolutionizes the way medical professionals monitor and analyze patient data. With its intuitive touch interface, doctors and nurses can easily navigate through its various functions and settings. Let us now understand the different parts associated with the ventilator. At the bottom, we have the compressor that provides the ventilator with a steady supply of compressed medical air. Additionally, it serves as a trolley, equipped with 4 wheels. The trolley features 2 front wheels with brakes, ensuring stability and control. Meanwhile, the rear wheels operate without brakes, allowing for easy maneuverability. On the compressor unit, you'll find a 3.2-inch monochromatic display. This display provides vital information, such as pressure readings, output pressure levels, runtime data, and various alarms. At the back side of the compressor unit, we have 2 ports. The first one is the inlet port, which is designed to connect the compressor unit to the hospital's medical air pipeline. This inlet port serves as a backup. The second one is the outlet port, which is where the medical air is delivered to the main unit of the ventilator. Below the outlet port is the drainage port where the moisture gets collected. On the left side is the power connections and the compressor on-off switch. The humidifier could be connected via the additional ports available here. The ventilator can be easily unmounted by pulling the lock as shown. The main unit of the ventilator consists of 2 inlet ports, one for air and the other for oxygen. Both the ports consist of water trap for the collection of moisture. The communication port is used for connecting the main unit with the controller or monitor. The RS-232 port is used for upgradation of the software. Below is the power switch that is used to switch on the ventilator. Next to it is the power socket used to connect the main power cord. The front side of the ventilator consists of the inspiratory port where the inspiratory limb of the breathing circuit is connected. Below the inspiratory port, in the center is the expiratory port where the expiratory limb of the breathing circuit is connected. It contains the expiratory click cassette that is fully autoclavable. The diaphragm and the flow sensor must be removed before autoclaving the cassette. The cassette can be easily inserted back into the port. To the right of the expiratory port is the upgradable window. For neonatal use cases, proximal sensors must be used. It consists of 2 ports, that is SpO2 and EtCO2. The ventilator has an inbuilt nebulizer compatible for adult and pediatric patients only. The 2 handles on either side of the ventilator helps in easy maneuvering. The central module encompasses essential elements such as the gas connections, gas tank, and electronic circuitry. This core unit acts as the central control center for the entire system. Incorporated within this main unit, the electronic circuitry plays a crucial role in regulating and managing the entire process. The main unit comprises of the compressor and the monitor. Let us briefly understand the parameters present in the monitor display. The highlighted parameters present on the bottom part of the screen are called brief settable parameters, also known as shortcut parameters. The parameters on the right side are called the measured parameters. At the bottom right, you have the IE ratio displayed, and below it are the date and time and the bed numbers. The highlighted symbol on the bottom right shows the battery status. On the top right corner are a few shortcuts, namely open suction, closed suction, O2 boost, manual breath, and nebulizer. The main section is the logs window. It displays the logs and status of 1,000 alarms present in the system. To check the alarm window, click on the alarm symbol present at the top. Here, you can set the upper and lower limit of the tidal volume, minute volume, respiratory rate, PPEEP, PEEP, FiO2, and air leak. The ventilator shall sound an alarm if the parameters go beyond the threshold set. Vital alarm section is handy if the ventilator is upgraded with SpO2, PR, ETCO2, ICO2, and RR. The PV tool or the protective ventilation tool will tell you the lower inflection and upper inflection points of the patient so that we can come to a conclusion on what settings of tidal volume or peak inspiratory pressure and PEEP for a particular patient that has to be set. Let us now understand different modes associated with the ventilator. Before selecting the modes, use the calibration menu to calibrate the ventilator to appropriate values. PRVC mode, that is pressure regulated volume control mode, operates by adjusting the inspiratory pressure to achieve the desired tidal volume, regardless of changes in lung compliance or airway resistance. Volume control mode is a commonly used ventilation mode that delivers a preset tidal volume of air to the patient with each breath. Spontaneous mode, also known as pressure support ventilation, is a mode of mechanical ventilation commonly used in medical settings to assist patients in breathing. PSV is designed to provide support to patients who can initiate their own breaths but may require assistance in overcoming the resistance of the respiratory system. In the auto mode, the ventilator autonomously configures parameter settings based on the patient's respiratory efforts, obviating the necessity for staff intervention subsequent to the establishment of the minimum percentage volume and predicted body weight parameters. Airway pressure release ventilation is a ventilation mode used in critical care settings to provide support for patients with compromised lung function. APRV is characterized by alternating between two distinct levels of airway pressure to optimize oxygenation while allowing for efficient removal of carbon dioxide. CPR mode is a specialized setting in mechanical ventilators designed to assist healthcare providers during life-saving resuscitation efforts for patients experiencing cardiac arrest or severe respiratory failure. Within the CPR mode, the PEEP setting is automatically reduced to 0, while the fraction of inspired oxygen is concurrently elevated to 100%. BiPAP ventilation mode is a specialized approach used in respiratory support, particularly for patients with conditions like COPD, sleep apnea, or acute respiratory failure. Allied Medical is a pioneer in the healthcare industry, providing world-class equipment, numerous life-saving medical devices. Please contact us for any technical assistance or expert advice.